Good morning, I'm Rosalie, and today we'll feature advances in healthcare treatments and new research findings, as well as the benefits of eating healthy to have heart health. If you're curious to learn more about yourself through genetic testing, you can benefit from this medical technology with invaluable health information, using this insight to better manage your health risks or even prevent developing certain diseases. Genetic testing is growing in popularity. It links genetic biomarkers that determine the best food, fitness, and lifestyle to help us make informed choices that will impact our future and rising healthcare costs. Joining us this morning is Dr. Erica Gray, co-founder and chief medical officer of Toolbox Genomics. Good morning, Dr. Gray.
Good morning, Rosalie. It's wonderful to be here.
After years of working in an emergency room, you identified a genetic link between a patient's health and chronic disease. Why is it so important to better understand our genetics to stay healthy?
It's all based about preventative care, and I think understanding your genetics is really taking you to the forefront of a healthier lifestyle. Once you have this information about a healthier lifestyle, then you can get information about how to live a lifestyle that's based on your gene style. And gene style is something where you live a lifestyle that is all about your DNA. You know, 100 years ago, we didn't know that much about DNA. 20 years ago, we used it for crime scene investigations, and now we can use it to create a personalized plan for you that's about diet, exercise, and even supplements.
What age group desires to learn more about their health through genetic testing?
Absolutely. So we find that most people who are very interested in genetic testing are the baby boomers as well as the millennials. The millennials are really interested in data and human performance, and then they have baby boomer parents who are interested in either certain conditions that they may personally have or avoiding the suffering that they've seen with their own parents.
Mostly if you have a parent who is adopted, like I did, and you don't really know much about the family medical history. So how is one's genotype data used to develop recommendations for a customized diet and lifestyle?
So first thing you have to do is get your genetic information, and you can get that through companies such as 23andMe and Ancestry.com. Once you've received your information, you go to toolboxgenomics.com, upload your information, and within minutes, you will receive a personalized plan that will feature suggestions about diet, exercise suggestions, and even some different supplements that you could be taking.
So what does a person find out from the testing?
So you will find out, are you predisposed to certain conditions, like perhaps high cholesterol? Maybe you break down caffeine slower, or maybe you just need a little more B12 in your life.
Once genetic testing is completed, what recommendations can we expect to receive?
So as I mentioned earlier, you will receive that personalized plan because we have taken the information from the other companies and we have run it against our database of numerous recommendations that we can put together for you, and then we can customize it to you, which is going to be based off of your gender, as well as even your ethnicity is going to play a role in our recommendations.
All right, doctor, so what if we have diabetes in our genetics? What recommendations would you offer?
So we will talk about monitoring your blood sugar. Sweet potatoes are a fabulous food that you could be using. We will talk about hill walking is a great exercise for pre-diabetics to lower your blood sugar. Then we can talk about some other features such as berberine is a great supplement that you could be taking. Using some apple cider vinegar before your meals can also help you lower that blood sugar as well.
In your research, you refer to a patient's biomarkers. What exactly are biomarkers?
So biomarkers in this sense is something that is unique to you. So these may be certain blood tests that you could do or your actual genetic data. But what's wonderful is that we now have the tools to measure so many different aspects of our life to really check in on what type of life we are leading and how healthy of a life we have.
And biomarkers are being used in new cancer therapies.
Absolutely. And you use it when you go and see your doctor and you get your cholesterol checked. That's an example of a biomarker.
Thank you so much, Dr. Gray, for joining us this morning to share the benefits of genetic testing to attain insight into reducing health risks and to ultimately live a greater quality of life.
Thank you so much, Rosalie, and kudos to you for bringing this cutting-edge information to your viewers.
Health and wellness experts agree a diet high in protein and low in sugar and carbohydrates offers significant health benefits, and that's the core of the South Beach diet. Cardiologist and South Beach diet developer Dr. Arthur Agatston joins us along with Dawn Zier, CEO of Nutrisystem, that recently bought the South Beach diet and reintroduced it as the home delivery diet. Good morning to both of you.
Good morning.
Dr. Agatston, you're a passionate cardiologist who 15 years ago introduced the overnight sensation South Beach diet. You shared what you knew how to prevent heart disease and teach others facts that contribute to heart health. So how long had you been using these techniques in your practice prior to writing the book?
Well, it really started in the mid-1990s, and I was watching my patients, along with the public, get heavier and heavier and sicker on what was then the recommended low-fat, high-carb diets. And the problem was when they went to low fat, we substituted bad carbohydrates. That's sugars, processed bread, rice, pasta, French fries. And that set off a survival mechanism that early man used to store fat in warm months when food was available that helped us survive the winter famine. With no winter famine, of course, especially in South Florida, everybody just got heavier and heavier and sicker. And we realized for our heart patients, medications wasn't the answer if they had bellies, prediabetes, and diabetes. And realized that we went to the good carbs and good fats, that they broke this cycle of really sugars going up and down and the survival mechanism. So it broke that bad cycle, and people could lose weight and feel good and improve their blood chemistries.
How does coronary calcium factor into heart disease risk?
Well, we developed the coronary calcium score, which is a way where you can see how much arteriosclerosis is developing in your coronary arteries years before you get a heart attack or a stroke. And we developed this in the late 80s, so I was watching patients with not very high cholesterols who were particular pre-diabetic or diabetic, who we knew were at risk because they had a lot of calcium, they had a lot of atherosclerosis. And so we realized there had to be an answer beyond just their cholesterol levels. And that's really what got me into the diet sphere.
This diet is proven to have a positive effect on heart health, weight loss, and belly fat. Isn't weight loss belly fat loss?
Yeah, no, absolutely. And the thing about starting the diet in the first phase is you lose weight, but you also lose your cravings and improve your blood chemistries. So it was primarily for my heart patients, but it was because they were developing more and more belly fat, which is part of prediabetes and diabetes.
Dangerous fat.
It's a dangerous fat, the bad fat. And if you don't get rid of the fat, medications will not work. So you can't just go home and have a pill. And that's why we worked hard to find an answer.
Why does the South Beach diet focus on low sugar and good carbs?
The bad carbs are all the simple sugars, table sugar and the sugar on donuts and all that. And then the processed carbohydrates, breads, again, going back to donuts and cakes, white rice, white pasta, white potatoes, particularly in the form of French fries. Those are the bad carbs. The good carbs are vegetables, whole fruits, whole grains. And at first, we substituted bad carbs for saturated fat. The bad carbs were actually worse than saturated fats. That's the animal fats. But the good fats are the olive oil, the fish oils, and polyunsaturated fats, and those actually are healthy. They're not neutral. So with good fats and good carbs, you can get rid of your cravings and your belly fat, and you can prevent heart attacks, strokes, but diabetes, many other chronic diseases, even Alzheimer's if you start in time.
Dawn, recently Nutrisystem acquired the South Beach Diet. How did these two companies' missions align and now grow as brands?
Well, both brands are in the business of transforming lives and helping people become that healthier version of themselves. So, the mission is very aligned. Nutrisystem has, as one of our core things that we do very well, is home delivery to consumers, and for a long time, which is great, because if you think about lifestyles today, we're very busy. We don't have time to cook. We don't have time to eat healthy. We love the principles of the South Beach Diet and developed a food program with all the things Dr. Agustin just talked about, the good carbs, the good fats, the low sugar approach, and developed a program that now can be delivered to households to help millions of people lose weight. We know people who struggle with weight loss often try different types of weight loss programs, so we're very pleased to have two well-recognized, scientifically backed programs, Nutrisystem and South Beach, that we know work. No fads, no gimmicks.
So, doctor, explain the process to start the South Beach Diet and then transition into Nutrisystem to eat healthy the rest of your life.
Well, from our point of view, a lot of South Beach dieters were foodies. They spent had time to shop and to cook. But our challenge was making it accessible to the general public, and that's the big issue. So by just making a phone call and getting food that tastes great and that gives you that first phase where you lose weight and your cravings is a great head start. And you can move to the second phase with the Nutrisystem, and then just go to the third phase, you're on your own. So it's both educational and healthful. And and even for me, I'm a chocoholic. I cheat over the holidays, and I use Nutrisystem to get back on phase one and set myself right. Otherwise, my wife said I could only do radio, no TV. So.
And there you have it. All right, Dawn, tell us where we can learn more.
Learn more at southbeachdiet.com. It's not only accessible, it's very affordable, $11 to $12 a day, which if you think about, driving through a Starbucks or something like that, you can get breakfast, lunch, dinner for that price. And again, it works, and, we're committed to helping America get healthy.
Thank you both for joining us to share how to break the sugar habit to maintain a healthy weight and a healthy heart.
Thank you.
You may not be aware of the major complications associated with type 2 diabetes coupled with cardiovascular disease. This combination is the leading cause of death for people with type 2 diabetes, causing approximately 2 out of 3 deaths in the U.S. I know how quickly this deadly combination can destroy a life after losing my father to this deadly duo. Joining us this morning to discuss a new development for adults with type 2 diabetes and cardiovascular disease is Dr. Christopher Cannon from the Cardiovascular Division at Brigham and Women's Hospital in Boston. And he's also the professor of medicine at Harvard Medical School. Good morning, Dr. Cannon.
Good morning. Thank you for having me.
So, doctor, how common is cardiovascular disease among people with type 2 diabetes?
Well, cardiovascular disease is the big thing that we worry about as a complication from diabetes. It's often something that can develop in the setting of other risk factors like high blood pressure and high cholesterol as well. But patients who have diabetes are 2 to 4 times more likely to develop cardiovascular disease. And so it's the real big worry of patients who have diabetes.
All right, so what's the distinction between low blood sugar and type 2 diabetes?
Well, diabetes is actually too high a blood sugar is the manifestation that we see most. On rare occasion, I actually have hypoglycemia or low blood sugar. That's a more rare thing. It can happen in patients who have diabetes who are getting treated because they're trying to lower the blood sugar. Sometimes it can go too low. And that has been really the focus in how diabetes has been managed, is all focused on the blood sugar. But we now have this new indication where we can start focusing on how patients' survival and risk of cardiovascular death. So exciting new developments in this area.
Okay, doctor, so let's discuss treatments available for adults with type 2 diabetes and established cardiovascular disease.
Well, there have been therapies available for decades, and despite that, of the people with diabetes who die, 2 out of 3 of them die from cardiovascular disease. And so all the treatments that we have are really not good enough. And there have been some large studies with many of the available therapies, the older therapies, where surprisingly we've not seen lower rates of heart attacks, strokes, or deaths until now. So it's a new era that we're entering.
Tell us about the new development that received an FDA approval.
So the FDA has just granted approval for a medication called empagliflozin, or Jardiance, that now has an indication for use to reduce the risk of cardiovascular death in patients with type 2 diabetes and known cardiovascular disease. It's actually already been approved for lowering glucose, but this is the first medication to get this indication that it can reduce the risk of cardiovascular death. And so it shifts our focus into the really important things of trying to prevent people from dying from cardiovascular disease.
So what research findings supports this FDA approval?
Well, the FDA looked at a large trial that was done. It was over 7,000 patients treated for 3 to 4 years. It was patients with type 2 diabetes and known cardiovascular disease who were receiving all their standard therapies. And then some of them were given the agent empagliflozin. And those patients had a lower risk of cardiovascular death, heart attack, or stroke. But the FDA called attention to a 38% reduction in cardiovascular death with empagliflozin. And so that became the basis of this new indication for use.
Is type 2 diabetes and cardiovascular disease inherent in our genes?
Yes, unfortunately, this is has a genetic preponderance and obviously related also to lifestyle and diet, but many factors go in. Then once a diagnosis is established, I think it is a call for us as doctors and working with patients to try and do good lifestyle changes and various medications control all risk factors we can. And then for this group of patients with known disease, we have a new therapy that could reduce their risk of dying from cardiovascular disease.
So if your family bloodline carries this combination, it could hit you as well?
The numbers have borne out. The starting point right now is 29 million people have type 2 diabetes in the United States, and it's several hundred million worldwide. And the development of cardiovascular disease is so common that the consequences really are quite staggering. And so we've been looking for how can we improve the course and the outcomes, and this is now a first step in trying to reduce the risk of cardiovascular death for these very high-risk patients.
All right, so where can we learn more about this treatment?
Well, I think there is information available on the web, but probably it's best a discussion between you, patients and doctors, either the primary care doctor or cardiologist, to see would this fit in and be appropriate for each patient. And so hopefully that can be a way to engender dialogue on this and all the treatments that could hopefully help patients.
Thank you so much, Dr. Cannon, for joining us this morning to share new findings and treatments to save lives for adults with the combination of type 2 diabetes and cardiovascular disease.
Thank you very much for having me.
Over the last 2 decades, the number of Americans with kidney cancer has risen each year. In 2018, approximately 63,000 new cases of kidney cancer will be diagnosed in the U.S., with an estimated 15,000 deaths. The most common type of kidney cancer is renal cell carcinoma, or RCC. It accounts for 90% of adult renal malignancies and generally affects people between the ages of 50 to 70. Those affected by advanced RCC have reason to feel hopeful due to recent new scientific advancements. Joining us this morning to discuss new treatment options available to some patients with advanced kidney disease is Dr. Sabby George, an associate professor of oncology at Roswell Park Comprehensive Cancer Center, specializing in the treatment of kidney, bladder, and prostate cancers. Alongside with Dina Battle, the president of the Kidney Cancer Research Alliance, KCC Cure. Good morning to both of you.
Good morning.
Thank you. Good morning.
Thank you for having us.
All right, so doctor, tell us more about renal cell carcinoma and how is this type of cancer diagnosed?
Renal cell carcinoma, or the commonest type of cancer in the kidney, which is a fatal disease. This could grow into a big tumor in the back of the abdomen till it is found out. So it could evade the finding of a tumor in the back of the abdomen for a long time. The commonest type of symptoms or signs include flank pain, blood in the urine, or a tumor or a mass in the back of the abdomen on palpation or examination by the doctor. So these are signs and symptoms of kidney tumors, and that's how it gets started or it gets investigated initially.
Research shows when kidney cancer is diagnosed at an advanced stage, almost 8% of patients live beyond 5 years, and their prognosis is even worse in patients with certain risk factors. What are those risk factors, doctor?
So there are risk factors used for classification of patients into risk grouping. There are 2 main types of risk grouping. One is called the IMDC database risk grouping or prognostic scoring system, and then the other one is called the MSKCC risk grouping. These are some factors which are changes in the blood test or changes in their functional status, and also the recurrence of the tumor after having the primary surgery for removing the kidney tumor. So these are basically broad classification of risk grouping, and they get grouped into favorable, intermediate, and poor risk based on the number of factors that they have. And then the outcome also varies based on these risk grouping.
So why is kidney cancer on the rise?
We don't know the exact reason, but in the past 2 decades, the kidney cancer incidence has been on the rise. But that being said, I could talk about some of the causes of kidney cancer which are known, and there are some unknown causes. The known causes of kidney cancer include hypertension, obesity, certain exposure to certain chemicals, and smoking. That being said, there are a lot of unknowns, and there are some familial type of kidney cancers which are transmitted from parent to the child, and so we don't know the exact reasons, but again, unfortunately, this is on the rise, and it's a fatal disease, and there is an unmet need to develop newer treatments.
Now, Dina, as an advocate, share with us why you started KC Cure and your advocacy efforts.
So the Kidney Cancer Research Alliance, or KC Cure, is a grassroots organization of patients and doctors that came together to increase awareness It's actually kind of a special story of how we started. I lost my husband to kidney cancer in 2009, and I joined together with Dr. Hans Hammers, who was the oncologist who treated my late husband. And we really wanted to increase awareness and increase research funding and make sure that no other family had to go through what my family had to go through.
Dina, tell us more about your passionate work as an advocate.
So we work really hard to increase awareness and education about the disease. We also provide research funding to those who are doing early seed funding research in kidney cancer. And we also encourage patients to connect with other people who are dealing with the same diagnosis, just so that they have a sense of community and they can talk to others who are managing this disease.
Dina, how old was your husband when he was diagnosed with the disease?
He was young. He was 40 when he was diagnosed, and it was a really shocking, horrible time for us. And as an organization, one of our hopes is that we can provide some of the educational material that wasn't available to us when my husband was diagnosed. And we're really grateful to industry partners like Bristol Myers Squibb who have helped us to provide that type of material for others who are dealing with this.
So, Doctor, a new combination therapy was approved by the U.S. Food and Drug Administration to treat certain people with RCC.
The recent approval by FDA is a combination of Opdivo and Yervoy, which belong to the class of immuno-oncology drugs. These two drugs together, they can activate the immune system, which is turned off by the cancer. And the immune system goes and fights the cancer. That's how this works. And the trial, Checkmate 214, demonstrated that the combination of Opdivo and Yervoy can shrink a tumor in a higher percentage of patients, as well as can make the kidney cancer patients live longer compared to the standard comparator, sunitinib, on that trial. So this is wonderful data. And also, 9% of patients who are treated with the combination went to what's called a complete response, meaning complete resolution of the tumors that they had.
All right, Dina, so what advice do you have for those living with RCC?
Two big messages. One is stay hopeful. New treatments like this are very exciting and give lots of reason to be hopeful. Two, be educated about your disease. We encourage folks to visit our website, kccure.org, to get more information. And also Opdivo.com is an excellent source of information about this new and exciting combination therapy that's available to patients with advanced RCC.
Thank you both for joining us to share new cancer treatment options and the support resources that are available to those living with kidney cancer.
Thanks for having us.
Thank you for having us.
Advancements in medical treatments, coupled with understanding our genealogy, will help decrease the risks of disease and increase heart health. So share with us your commitment to better manage your health risks so that you're prepared to endure all of life's many challenges at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. And watch this episode and many others here on Discovery Life or 24/7 at RoseleeArcherShow.com. Thanks for joining us this morning, and we look forward to seeing you soon. The proceeding was a presentation for The Rose Lee Show. The views and opinions expressed in this program are not necessarily those of this station.